kick off here. Okay, so welcome everybody. Today we are going to be talking about generic services. What are generic services? So I do want to point out, since this is going to be recorded, that we are presenting this on October 28th, 2025. We are in the midst of a federal government shutdown right now. So this is always a piece of advice that I would give anybody if you are watching a recording of a webinar about disability services. You're always going to want to check to make sure, check with the agency who provides those services to make sure you have the updated numbers. So we're going to present to you what the eligibility is as of today and what we know for January. This is the second in our Community Navigator workshop for the fall. We also did one earlier on regional center services. So let's talk a little bit about, we will talk about generic services first. If you're not familiar with Family Focus Resource Center, we are a service of Cal State University Northridge's Special Education Department. Our motto is your best resource is another parent. Everyone who works for Family Focus is either a parent or a family member or a caregiver of someone with a disability. My name is Catherine Sinelli. I coordinate our Community Navigator program, and I'm the parent of two regional center consumers who are 18 and 15. So we have 4 offices. Our main office is on campus at CSUN. And then we have an office in each of the North Los Angeles County Regional Center offices. So one in Chatsworth, Santa Clarita, and in the Antelope Valley. And we're located just off the lobby in all of those regional center offices. So how are we funded? So Family Focus is a family resource center, and that funding comes through the Department of Developmental Services, and we serve families of regional center consumers. And then we're also a family empowerment center, and that funding comes from California Department of Education, and we serve families who of students in special education. So we end up serving really the whole lifespan. We'll have links. We'll drop links again into the chat for our website. We have lots of parent support groups on our calendar, all kinds of events, more workshops like this, where either Family Focus staff is giving a presentation on a topic that we normally help parents with. And then we also have a lot of professionals who are giving, who have specialized knowledge about a variety of disability topics. And then these are recorded and put on our YouTube channel. So you can watch them anytime, which I think is nice. All right. So now we're going to talk about generic services. This might be something that you've heard and you're like, what are they talking about? They'll say what generic services. You might also hear generic resources. And what it is these are services that are available to the general public if you meet certain eligibility criteria. Now, Regional Center will consider any outside services or supports as a generic resource. For our purposes today, we're going to talk really just about the government services that you may be eligible to apply for. Okay, so here is a myth. A diagnosis automatically qualifies you for services. Unfortunately, this is not true. But let's talk about what are the facts. So each service has their own eligibility criteria, and there can be financial and or disability criteria. So sometimes it's just financial criteria, sometimes it's just disability criteria, and sometimes it's a combination of both. Disability eligibility usually requires showing specific functional limitations. And we see that in regards to SSI and IHSS in particular. And we'll go through a little bit about what those look like for those particular services. So the services we're going to go over today include Medi-Cal, IHSS, SSI, CalFresh, California Children's Services, and the California Department of Rehabilitation. So we're going to start with Medi-Cal. So Medi-Cal is California's Medicaid program. It helps low-income families and individuals with disabilities pay for medical expenses. It's essentially another form of health insurance. It covers preventative care, outpatient visits, hospitalizations, prescriptions, what would normally be covered under health insurance. However, you will need to see a provider who's in your Medi-Cal network. Who is eligible? So residents of California with satisfactory immigration status. That's the new terminology that the state is using. So we're going to use that here. So we all get used to hearing the same terms. Families and individuals with limited income and resources. If you receive supplemental security income, which is SSI, you automatically will receive Medi-Cal. And adults age 19 and older can apply even if they still live with their families. There are some specialized circumstances. So if you have a child in this age range, or if you are in this age range, contact us and we can kind of walk you through that process. So there's also a process called institutional deeming, which is kind of a scary term, frankly. But what it means is that regional center consumers who are children can qualify for Medi-Cal even if their family's income and resources are above the limit. So you must be under 18, although again, there's some other, with Medi-Cal and ages 18 to 20, there's some other requirements, so we can talk about that. But you have to be a child and you have to have at least one billable service through the regional center. That can be social rec, that can be respite. Just have to have some service that the regional center is providing for your child. You can ask, the way you start this process is with your CSC. So you tell your CSC, hey, I want to start the institutional deeming process and the Medi-Cal waiver. And they should get that going. Children in Early Start, which is the program that's from age birth to 3, are not typically eligible unless they have a condition that we know is going to qualify them for services after the age of 3, like Down syndrome. So a 2-year-old with Down syndrome could get the waiver. Generally, though, if you're in Early Start, it's you're not eligible. So what happens when you start the institutional deeming process? Your CSC refers you to their Medi-Cal department, their department that handles this. They send the waiver directly to Medi-Cal, and the Medi-Cal sends you a packet, and you receive a application packet in the mail. You can either fill out that packet, or we usually recommend filling it out online. We'll go over that in a minute. Now, every time you have a reauthorization of Medi-Cal, you will have to ask the regional center to send a new copy of the waiver. So how do you apply? So we recommend that if you are applying for Medi-Cal, also CalFresh, that you should have an account online with Benefits Cal. It's really a good way. It's, I think, the easiest way to upload your documentation if you have the technology to do it. Then you can also see it, and you can do it from your phone as well. You can see the documentation that you've uploaded, which can be helpful if Medi-Cal asks you for something else. You can fill out the packet that you'll get in the mail with institutional deeming is actually a covered California packet. You can fill that out and mail it back. You'll need to provide proof of residency and identity. You'll also need to submit financial information. Even if you have the waiver, you will still need to submit all of your financial information, even though they're not counting it. So with Medi-Cal, be sure to respond to letters asking for more information, even if you know you've already sent it to them. You can mail the information back to Medi-Cal or upload it on Benefits Cal. Sometimes then what we've done in the past, we'll upload something and then we'll call the number and say, hey, I uploaded it. Can you see it? Can you confirm that you see this? So sometimes that has to be what you have to do to make sure that they have received that information. If they don't receive it by the date that they put on the letter, you might have to start the application process all over again, which unfortunately we do see happen. Okay, changes to Medi-Cal. So there are both the state of California and the federal government are making changes to Medi-Cal and Medicaid. At the moment, we don't know how or when federal changes will be enacted. But the state of California has announced some changes and when they will go into effect. So I'm going to go through those now. Again, as of October 28th, 2025, this is the information we have. This first slide is about the asset limit. The information on these next, I think there's 4 slides, is taken directly from Medi-Cal's page on the changes, and I do link to that if you want to see it. An important thing to remember about both the changes in the asset limit and the changes in eligibility based on immigration status is that these changes essentially went into effect in 2024, January 2024. So they removed the asset limit in January of 2024. They're bringing it back in January of 2026. So essentially we had 2 years where we didn't have an asset limit, and the asset limit is coming back. Currently, the asset limit, the information we have on the asset limit is that it's going to be $130,000 per person. Each additional household member adds another $65,000 to the asset limit, up to 10 members per household. Assets include bank accounts, cash, and anything over 1 home and 1 vehicle, but some assets don't count, like the home you live in, 1 vehicle, household items, and certain savings like retirement accounts. If you're already a Medi-Cal member, assets will be reviewed at your annual renewal. The income rules are not changing. And again, if you had Medi-Cal prior to 2024, you had to do this process anyway. Another important thing that I'm getting a lot of questions on is, does this apply to, or does institutional deeming apply to assets? And the answer is the waiver includes income and assets. So as long as the assets are not in the child's name, like the child doesn't have a trust fund in their own name, assets will not be counted with, in the same way that income is not counted for institutional deeming. So the next 3 slides refer to adults with adults who do not have satisfactory immigration status, okay? So there's going to be an enrollment freeze for undocumented members. If you're already enrolled in Medi-Cal, you will stay covered no matter your immigration status as long as you complete your annual renewal. So if you're part of this group and you lose coverage, you won't be able to sign up again except for emergency and pregnancy care. If your coverage stops because of late renewal or missing paperwork, you have 90 days to fix it to stay enrolled. Income eligible children and pregnant people can enroll in full scope Medi-Cal no matter their immigration status. So that's not changing. Coverage is for the entire pregnancy and 1 year after the pregnancy ends. Dental coverage, as of July 2026, for members who are, sorry, I'm just double checking. Okay. For members who are adults who do not have satisfactory immigration status, dental benefits will no longer be available. You can get emergency dental care, but the full dental benefit will not be available for adults with unsatisfactory immigration status. And again, this doesn't include pregnancy, so you'll have access to the benefits if you are pregnant. In July of 2027, Californians aged 19 to 59 who are not pregnant and do not have satisfactory immigration status must pay $30 a month to keep full scope Medi-Cal. So that's planning on starting in July of 2027 will be the premium. If you do not pay your premium, it'll be reduced to emergency services. So I have links here, and you'll get the copy of the slides with the links. This is the Medi-Cal website. This is the link to what I'm talking about. That's where I got this information. And then I also put the State Council on Developmental Disabilities and the ARC of California. They've been very involved in legislative advocacy, and they've been keeping up to date with these changes and other changes as well. So those are good reference points as we move through this, what is really an uncertain time. All right, we're going to move on to in-home supportive services, or IHSS. So this is a program that's available to low-income seniors and disabled people, and the goal of the program is to help a person remain living in their own home. This will be another tip I think we can give as navigators, is always to remember the purpose of the program, because that will help you understand the eligibility requirements. So the purpose of IHSS is to help you remain living in your own home instead of going into a nursing home, essentially, or a group living situation. Who is eligible for IHSS? You must be over the age of 65 or disabled. You must have Medi-Cal. You must be a California resident. Live in your own home. So if you're in a group home or a hospital, it does not count, or a nursing home, doesn't count. Disabled children can qualify to receive IHSS. So how do you apply? You can fill out a paper application and take it in. I usually find by phone is fastest. You can call, you can get your case number, and the payments date back to the day you got that case number. I also included the link to LA County Department of Social Services IHSS page, which has a lot of this, has all this contact information on here. So after you have received your case number, you should get the healthcare certification form in the mail. It's SOC 873. This form needs to be filled out by a doctor or a therapist. It needs to be filled out by a licensed clinical professional. Could be a BCBA. What that person needs to verify that the individual is disabled and that they need help to stay in their own home. If you don't receive this form in 2 weeks, go ahead and print it out and take it to your doctor, because the case will be closed if it's not returned within 45 days. After it's been received by IHSS, the healthcare certification form, you'll get a date for your home visit. And how do you prepare? You're going to want a list of all the medications, all the doctors and therapists, when you see them. And then you want a list of how you or your child needs help in each of the IHSS categories. So we'll go through some of the common IHSS categories. Now you'll see that there's minimum age requirements for these. The idea behind IHSS is that what help does this person need that a child of the same age would not need? So you see bowel and bladder care for age 4 and older. The expectation is that, well, a 2-year-old or a 3-year-old is not going to be potty trained. Any 2-year-old's not going to be potty trained. So parents would be expected to do that, to help with bowel and bladder care for a child. Dressing, age 5 and older, bathing, oral hygiene, grooming, age 8 and older, and feeding, age 8 and older. We have, if you're interested in applying, please contact us and we have lots of information on each of these categories. I hesitate to say their age limits. So we recommend that if you are helping your 6-year-old with all kinds of bathing, oral hygiene, and grooming, write it out and tell them everything that you do to help your 6-year-old. I have seen children younger than age of 8 receive some hours for bathing, oral hygiene, and grooming, as well as feeding, if the need was great enough. For like some of our kiddos who have maybe a genetic condition that affects muscle tone, and feeding is they got to cut up food in tiny bits, so they because choking is an issue. I've seen hours for feeding uh, uh, be given in those kinds of cases. But it's good to have these guidelines to understand how the county is going to come in and look at the situation. These are other IHSS categories: transfer from a bed to a chair, ambulation, so those are mobility issues, respiration, so this could be using oxygen, medications and prosthetics, that's all medications. And then there's paramedical services, which have to be approved by a doctor, but this is for our folks with like G tubes or tracheotomy, um, uh, colostomy bags, all those kinds of things. Some help with testing blood sugar. Those kinds of things are paramedical services, which you can receive IHSS hours for. They'll need to be approved by a physician. Okay, so children under 18 do not generally qualify for these services, which are called domestic services: laundry, meal preparation, shopping and errands, and housework. It's possible to qualify for something like laundry if there was someone who was, continually, there was a medical condition that was causing like lots of soiling of laundry. It's possible. But generally, they don't qualify. So there's another category of hours for IHSS. It's called protective supervision. And this is for individuals who have severely impaired memory, judgment, and orientation, and need 24-hour supervision to safely remain in their own home. How do you apply for protective supervision? You're going to want, excuse me, to have the doctor, again, doctor or therapist, licensed clinical professional, complete the protective supervision assessment form. This is SOC 821. You're going to want to keep a log of any dangerous behaviors that you're seeing. Elopement, kitchen safety is a big one. Another one that we see is putting, either trying to eat non-food objects or continually putting non-food objects in the mouth. And also sleep disturbances, getting up in the middle of the night and turning on the water. Those would be things, lists of dangerous behaviors that you would want to look at. The other piece is you'll want to have therapists or whoever's working with your child write letters documenting the dangerous behaviors they see. We've seen that can sometimes be more impactful than giving like a whole IPP report or IEP report, where that they have to go through and there's all kinds of stuff in there. Just having that letter of that paragraph that's like, this is what I have to stop this child from doing in a session, right? That can be impactful. Then parents can be IHSS providers. When you call to apply, I usually advise parents to go ahead and begin the provider enrollment process at that point. You will have paperwork. You will, they're asking now to do an in-person orientation. They'll schedule you for an in-person orientation. And you can turn in some of the paperwork then, which is kind of nice. You go in person and then you've got everything set up. You'll also need to get fingerprinted, and then complete the provider orientation. Some of it's online as well. This is a copy of the provider enrollment form. Oh, to be eligible to be a provider, you just need to be over the age of 18 and able to work in the United States. All right. It's a lot of information on generic services, guys. Thanks for hanging in there with me. Okay, supplemental security income. This is SSI. What SSI is it provides monthly payments to people who have limited income and are over the age of 65 or have a disability. Supplemental security income is not Social Security. It's not Social Security disability insurance. Social Security and Social Security disability insurance you pay into when you work. So that's, that's one of the line items on our pay stubs that it's taken out. You can receive supplemental security income, SSI, and you would have never had to have worked. It's a federal program with the state of California adding some additional money to the payment. Who is eligible? You have to have limited income and resources, very limited income and resources. You have to be disabled or over the age of 65, be a U.S. citizen or qualified non-citizen. Children can receive SSI, but parents' income and resources are considered. So more information on SSI eligibility can be found on the SSA, that's the Social Security Administration website. This is really great. This will give you a calculator that you can put in your income and see if you would be eligible for it. And then there's also information on if you'll meet the resource limit or not. How do you apply? So you can start your application online, over the phone, or in person. Not so much in person right now. Even before the shutdown, they were requiring an appointment. So we encourage people to either call and make an appointment or start the application online. You'll want to apply for a supplemental security income for disability. There'll be a lot of different things you can apply for it. Make sure you're applying for supplemental security income. You can get more information on the SSA.gov site. It actually has some pretty good information on there. We go there frequently when we have questions. What information will you need to fill out the application? This was, I will quote Christy Lacey, who's another one of our navigators who is on the call helping me today, when she said everything. So it is a lot of information for SSI. You're going to want a list of all the doctors and therapists. You're going to want to know when you saw them last, every test assessment that's been done. You want the school information. You'll want regional centers information, everything that you can give them. And there will be some financial information that you'll need to provide as well. So SSI, the entire point of SSI is to help supplement income for people who are disabled, who are too disabled to be able to provide gainful employment, to support themselves through gainful employment. So that's really what they're looking at. For a child, they're going to look if the disability significantly impacts their daily living. So they use specific criteria for different disabilities, and you can see what the list is. We'll take a look at autism in just a minute. So reading the criteria can help you know what kinds of examples you should give in your application, right? And this is a link to what's called Social Security's listing of impairments. It's sometimes called the Blue Book. So here are the qualifying criteria for autism. So A is essentially, it says medical documentation of both of the following, which are qualitative deficits in verbal in communication, and then restrictive and repetitive patterns of behaviors. That's essentially the autism diagnosis. And then extreme limitation of one or marked limitation of two of the following. Understand, remember, and this says of the following areas of mental functioning. So this is where we talk about those functional limitations, right? In IHSS, the functioning is, what help do they need with their grooming? What level of function in that area? Again, here this is a mental level of functioning. Understand, remember, or apply information, interact with others, concentrate, persist, or maintain pace, and adapt or manage oneself. And you'll want to give examples of how that functioning is impaired in those categories. So I will say that SSI has a pretty high bar for disability, is something that we see. So we see people who qualify for regional center services, but SSI will say that they are not disabled enough to reach SSI. So we just want to make sure people understand that there is a SSI sets a pretty high bar. Okay, CalFresh. So CalFresh gives low-income families a monthly allowance, and individuals as well, gives them a monthly allowance to buy food. It's loaded onto an EBT card, an electronic benefits transfer card. It's used like a debit card to buy food, non-alcoholic beverages. It doesn't pay for clothing or other household supplies. And I think this is cool about CalFresh. You can get additional money to shop at certain farmers markets through the Market Match program. So who is eligible for CalFresh? Families or individuals with limited income. There is not an asset requirement for CalFresh. So if somebody gets laid off, and there's a change in family's income, you can apply for CalFresh. Be a U.S. citizen or qualified non-citizen. This is a federal program. CalFresh is our version of the federal program. Adults living with their parents must be over the age of 22 to apply for CalFresh on their own. How do you apply? Again, benefitscal.com. We like that site. You can call LA County Department of Social Services or visit your Department of Social Services office. So this is California Children's Services. So California Children's Services provides medical services, physical and occupational therapy to children under 21 with a CCS qualifying health condition. I wanted to include this because it is really helpful for our families who have children with medical conditions. A lot of families I know who have used the program really like it. Some of the therapies are connected with schools. So there'll be like a CCS provider within a certain school, out on a certain school campus, and you can go to get the therapies there. Here are the eligibility requirements. You need to be a California resident under the age of 21, receives Medi-Cal, or the family is low income. So they calculate how much the percentage of your income that you spend on health issues, on medical expenses, is how they calculate low income or Medi-Cal. And then you have to have a qualifying medical condition that's not solely that's not just a developmental disability. So autism or IDD would not be eligible on their own. There would need to be a accompanying medical condition. And you can see what the medical conditions are here. And you just have to fill out an application and send it in. So this is the application, and this is more information on how to apply. And then the Department of Rehabilitation. So they fund job training, education support, and some supplies for employment. You just have to have a disability that impacts your ability to work and be over the age of 16. Some programs start as early as 14 if they're based in the school. We find the best way to apply for the California Department of Rehabilitation is at a DOR office, to go in person. You can fill out a form online and have someone contact you, but generally we find it's best to just go in. And there's more information here on the DOR services. Okay, so if you live in the North Los Angeles County Regional Center area, we can help you apply for services or give you more information. So please reach out and let us know. We have a whole team of navigators who are helping families apply for these services and navigate them. So now, and there we are. Yes, so now I will go ahead and